is Ezekiel Oburu. I'm an orthopedic surgeon at Nairobi Spine and Orthopedic Center, and I also teach at the University of Nairobi. And today we want to demonstrate how to remove a plaster cast. And we have our patient here, Naomi, who we have applied a cast for a distal radius fracture. And we have Zachariah Kimengich, who is our orthopedic trauma technologist, and he will be demonstrating how to remove the cast. Now, I want to say one thing about this, because as doctors, we always have to remove casts. Sometimes we have patients, children, and sometimes we have even adults who are pretty scared about the sight of a saw going near their hand or near their leg. But one of the things that I always do, and I always illustrate to the patients, is the way this saw works. It's an oscillating saw, and it doesn't cut unless you apply constant pressure, and it will cut by friction. So when you're removing a cast, and Zach will demonstrate this, it will not cut unless you apply continuous, constant. And if the patient has got a cast which has just been applied with swelling and an injury, and the soft tissue is swollen, the more likely it will cut the skin of the patient. One of the other ways to relax the patient is, I put it in like this. I put it on, and then I show the patient, look here, it will catch you. I always show the patient. And if it's a child, I will take the mother of the child and I'll show the mother of the child, because the mother is also scared. It will not cut. The only way it will cut is if you continuously apply pressure. That way it will cut. So without much ado, I will ask Zach to demonstrate how he will remove this from Naomi.
Yeah, it's very important before you remove any cast, like now, duration. Give it around 6 weeks, and always you do a check X-ray. So allow me to be able to demonstrate on how to remove a cast. It's important to wear your protective gears, the gloves. Then positioning of patient is also very important. So our patient is comfortable. So we want to remove, and basically most of the time we normally mark. We normally put a mark from the anterior and also posterior. So we normally give a nice marking as a guide to be able to show you how we are supposed to be able to cut. So you hold your electric cutter machine very comfortably. Reassure your patient that you will not be able to cut, you will not be able to harm. Give that assurance. And then after that now, your patient will be able to give you go ahead. So I've already explained to my patient that it will not be able to hurt or even harm. So we are just cutting it on this cast. So when we're removing it, the cast, you always in, up, in, up, in, up. It's very important to know how to remove. So you can be able to see in, up, in, up, in. You can see in, up, in, up, in, up, just like that. So let me say maybe you can actually be able to repeat maybe some areas that are not really be able to reach, and because of the other pan, it will not be able to hurt the patient. So you'll actually be able to feel when going in, up, in, up, in, up. See? Always in, up. Then you can actually be able to turn. You can actually be able to turn the same thing to anterior. Since I have my assistant, so in, up, in. Very good. it just go deeply in, out. In, out. Until you are able to reach there. You can actually do a repeat where you've not probably reached. In, out, in, out. In, out. In, out, in, out, in, out, in, out. After that, now you get your plaster cutting scissor.
Or your spreader.
Yeah, have your spreader there. This is plaster spreader. So same. This is now this is for opening up. You want to open up this cast.
Sometimes you may get the scissors
Yes.
and just open a little bit there,
Can
and
you
then
able
the
to see?
spreader goes in.
Thank you. Can you able to see that? So it's open up. Can you able to see? It's open up. It's spread. That's called plaster spreader. It's spread. Then you can actually be able to remove the entire cast. Then, having your plaster scissor, you can actually be able now to cut, going all the way it's very important. So we are cutting our orthopedic padding. Yes. Then actually you can now be able to remove your cast. Then this is, from there now you can wipe, clean. Then now you can send the patient if there is any joint stiffness to be done some physio.
Good, so thank you very much. So always be careful. It may look as simple, but I think Zach showed it in, out, in, out, in, out, and that way you will not cut the patient. Thank you very much, Naomi.